Guys, welcome to our YouTube channel. So we have another final story here, a final video. Bro, I'm so happy. At the same time sad that you are leaving because such a great guy, but I'm so happy for you. Especially when I see the changing. I mean, it's a priceless, bro. So let me ask you, what was your height before all the surgeries? What is your current height after the surgeries?
Before the surgeries, I thought I was 163, and then when I came in, you said I was 162.5. So let's keep it at 162.5.
162.5, right?
Yep.
In inches, you know?
So in inches, that would probably be close to 5'4".
5.
Yeah, a little under 5'4". Yeah.
What is your current height?
Current height is 179 centimeters. So, yeah,
In inches is like 5'11", right?
close to 5'11".
Close to 5'11".
Yeah.
All right, step by step, because I have a lot of questions. Bro, we start with your femur, and then you decided also the tibia as well. So that's the reason, guys, why we did approximately 16.5 centimeter. In inches should be 5 inches, like
Ooh, yeah.
5 inch, right?
No, it should be more than 5.
More than
inches.
5,
So
6 even.
6, a little over 6.
Wow. Okay. So first of all, when you start your femur surgery with us, when was it?
October of last year.
October 2024. So
Yeah.
we have now 1st of September 2025. Okay, you did your surgery, the femur with the LON, right?
Yeah.
So
with
how
LON.
much you reach there?
With LON, I reached 10.5 centimeters.
Okay, 10.5, more than 4 inches. And then when you came back for the tibia, can you explain a little bit, please?
Yeah, I mean, before femur surgery, I kind of knew I was always going to come back for tibia. I chose the LON on femur because I wanted to max out. And so when I maxed out femur, 10.5, then for tibia, I knew I wouldn't have to do too much. So 6 was all right for me. Right?
Okay,
Yeah,
and you
but
reached 6.
yeah, and I reached 6. Yeah, but I always knew I was gonna do femur and then tibia.
Okay, that was your goal even before.
Yeah, even before.
Once you did your femur, 10.5 is like such a great and huge goal. When you could walk normally, by the way?
After femur, I would say after 2 months, then I was able to walk like without the crutches. Okay. I was comfortable walking without the crutches. So when I came back for tibia, I actually didn't use any crutches when I came back. So I walked all the way.
Great.
Through the airports, everything, and then
Great.
yeah, came in.
So, how was your experience with the LON method? Because like there's some people, some doctors who saying like LON is dangerous, don't do it, or it's like old-fashioned, something like that, which is reserved for me old-fashioned for limblengthening surgeries. I'm talking for sure. So, how was your experience with the LON? Would you do it again with the LON or?
Absolutely. I think after doing LON twice, I mean, if you'd ask me, I would go for LON. I mean, I see people do the Precice and all that, but for me, I wanted a max, and I think for the max, you could only achieve that with the LON, right? So if you wanted 10 centimeters on femur, you'd have to go for LON. So for me, I'd always decided that it was going to be LON. And after going through with it, I have no problems with the LON. I'll choose it again.
Okay, and the pain, how was the pain for you?
Yeah, I mean, it is painful. There's pain, there's discomfort, but that's something you'd have to embrace because no pain, no gain, right?
For sure.
Yeah, so I knew it was going to be painful, so I braced myself for that and prepared my mind. Yeah.
Well, bro, I mean, like, for example, yeah, of course, there's pain. I mean,
Yep.
for me, was mostly the discomfort. I mean, when we say pain, it's not like you scream or something like that. But the most important thing is you should calculate, is the pain and the discomfort, is it worth it for that what you gain? If yes, we don't, I mean, I told to myself, you don't need to talk about pain. You know what I mean? Of course, guys, I mean, this is not like you are not coming here to vacation, for sure. So, I mean, but please watch the before and after picture. I mean, and tell me, by the way, is the pain, is it worth it for all those things like surgery, timing, you know what I mean, all those things. So is it worth it or not? Tell me in the comments. We saw your before and after picture, like before the femur and tibia and after femur and tibia. So tell me, And also you check like, you know, we did the photo with
Yeah.
your old self, you know. So tell me, how is the feeling for you once you saw that?
It's amazing. It's amazing, right? You see the massive transformation from this guy that was so short to this guy that's like tall. And I mean, I never believed that that could happen until I'm actually seeing the photos. I mean, standing on on the measuring the height and seeing how tall I've become now. So I mean, it's massive, and the feeling is amazing to go through this. Yeah.
This is before the tibia, and now look at that, bro.
Ooh. So you were taller than me, yeah?
Of course, bro. Hey, come on, 3 millimeters. So, but look at that. I mean, it looks really, really great, bro. I mean, your upper body, the proportion and everything, so it looks amazing. I mean, you can't imagine that you was like short before like that, right? I mean, this is crazy. This is really, really bro. That's amazing, man. So, and also now when I sometimes, you know, like on my phone and I'm looking my before and after pictures, say it's impossible. So, I mean, how Sedat, like, you are not that guy, you know?
Yeah.
But bro, you look amazing now.
Yeah, thank you.
So you're welcome, bro. By the way, Ben like had also a great time here without any complications, nothing. The bone healing is great. Can you tell me like why we don't have any complication and why your bone healing is good?
Well, I did get a bit of complication with the femur.
Okay.
I had some kind of skin issues. So sometimes I took days off lengthening just to give the skin some time to heal. So yeah, I had that. But I mean, it was nothing they couldn't fix here. So medical team worked with me on that, and I was able to get through that. But yeah, overall, I didn't have any, I mean, crazy complications. So
That was what I'm talking.
yeah, everything was smooth. I guess maybe I'm a bit lucky, but also, I mean, we have a great team here.
Appreciate
So once they see that anything is maybe a bit off, I mean, you talk to them, you work with them, they're able to guide you through all that. So I think that's really, really good.
I mean, the skin problems what you had is like typically common case for LON because you have to imagine there's like pin. The wound is not open, but it's like also not closed. You know what I mean? So and you stretch the bone at the same time the skin tissue at the same time you stretch the pins as well. Such a skin infections or superficial infections is absolutely normal, like not absolutely normal, but common case for typically like LON patients. I had that several times, bro. But thanks God we don't have any like major complications like no mechanical or bone infection, something like that, which also can happen, you know. So which we also have solutions for it. But everything was great. And also, guys, that's really important now, bro. The 6 centimeter on the tibia. In which time frame you reach?
I think I got that in 2 months. Yeah, I think just around 2 months I got a 6 centimeters.
216. Okay, can you explain me? In 216, which is great, but tell me, bro, you don't have any ballerina syndrome.
Well, I do have a little ballerina.
That is not ballerina. Guys, please check the photo exactly on the side. So that is not ballerina, bro. It's maybe, I mean, even you have to like, you know, like you have to really watch precisely, but no, bro. I mean, there's really not a ballerina syndrome.
Yeah, I mean, throughout the lengthening, physio team gave me these shoes that you can wear when you're sleeping. I wore them couple times. I didn't wear them all the time. They are kind of very uncomfortable.
Yeah,
So
I know.
I didn't wear them all the time, but I tried as much as possible to wear them. And then also, I think the physio sessions are really good. They focus on trying to help you be able to bring your leg up this way to get rid of ballerina. So that was really good. And then after removal, showed me a couple of exercises like standing against the wall for some time. And once I began to do those, I felt like the ballerina was reducing. Yeah, so I think, yeah, it's a combination of all those.
I mean, amazing. So that means like your recovery will be really smooth, by the way. We saw also on your femur. Because ballerina syndrome is something which delayed the healing process a little bit. I had huge ballerina, by the way, bro. So yeah, I had really huge ballerina. So, but now yours is amazing. So, and I'm really happy for it, bro.
Yeah.
So you have to imagine, they will be like peoples who are watching the video, because the people who's watching the video is like people who's interested in, maybe they have the same problems as you and me. So, and you know, like they try to close his eyes and imagine, but he got now crazy height, so he's like close to 180 from, you know, like 162. So what exactly will change in Ben's life? So that will be like the question maybe on their mind. Bro, can you explain us? So did you thought about it? What exactly will change?
I think a lot will change. I mean, height is viewed by society very strongly, especially if you're a guy. So if you don't have a good height, the way people treat you is different. Once you are taller now, people generally treat you better in society than when you're shorter. So I'm hoping that I'm going to get a better treatment. I know I'm going to get better treatment now that I'm taller than I am when I was shorter. So, I mean, for me, motivation had always been, I mean, if you can better your life, I mean, yeah, then do what you need to do to try and better your life. And if you're a guy, height is one of the main things you can do to change that. So it's going to be massive for me. I feel I'm going to enjoy this new height a lot, and I look forward to it. Yeah.
I mean, bro, believe me. So it's like, yeah, this is something what we are doing, like changing lives, which is amazing, sometimes really hard, but bro, I mean, to see that, to see your life changing. I mean, the band before the femur and tibia in front of me, I remember, and I saw also the pictures again. And now a new band in front of me, like he's tall, and I'm looking not down anymore, I'm looking up and talking like that to him. It's an amazing thing, bro. So, and we are so blessed. I'm so happy to have such an opportunity, bro. So, because as you said, the height for men and women, it's important for sure. But especially for men, it's like, this is like the makeup of men, you know what I mean? Even much more than that, you know? So, and that's the reason why I'm so happy for you, bro. And I'm telling to the patients, you know, like the best thing what we can show to the peoples that we are doing a really good job is the patient is doing the first surgery with us, is leaving, and decided to come back for the second surgery. So because he decided to do the second surgery because of he was happy and he saw the results. Now my question to you, first of all, thank you, I really appreciate it, bro. But what was the reason to trust again your life in our hands, to live life taller?
I mean, for the first surgery, I had done my research before coming, and I picked Livelifetaller because, I mean, I liked what I saw. I liked the reviews I was seeing. A couple of people I spoke to, I got very positive feedback. So when I came for the first surgery, the experience I got here, and one thing that we should not underestimate is the community that you have here. Of course, we have a very good facility here, physio, medical team, nutritionist, everything in one building. That's fantastic, so you get all you need. But also fellow patients here. You talk to other patients. I mean, you share similar journeys. You're going through similar struggles. You encourage and motivate each other. That's fantastic. And once you have that sense of community, it motivates you to try and achieve your goal. And some people have come here with lower goals, and once they've talked to other patients and seen how patients are trying hard to reach their maximum goals, they've also changed their goals, and they were able to achieve it. So it's fantastic. Yeah.
I appreciate it, bro. Have you never been afraid about complications or like anything like that?
I knew it's possible to get complications, right? Everyone is hoping you don't get complications, but if it does happen, I am trusting that Livelifetaller is able to help you to deal with those complications. And from what I've seen, I think you're doing a good job at that. So I think, yeah, so far, so good for me.
Thank you so much for your trust. So what you feel about, or what you can say about your scars, are you happy? Or would you say it's big, so I'm not so happy? And my second question, what would you say about your new proportion?
For the scars, I mean, I say my biggest scar I have is not from limblengthening, so that's from a different
Great.
incident, right? So I've never been afraid of scars, so the scars didn't bother me, right? So yeah, I mean, if I need to get scars to be taller, then I'll take more scars and then be taller. So yeah, it didn't bother me at all. So for the proportions, after I did the first surgery, proportions looked like really good. After the second one, I felt maybe legs were a little taller,
Okay.
right? But after seeing the before and after, I feel okay, maybe they are not so tall, and I feel that as I continue to recover, maybe get a bit more muscle around my legs, I mean, they are kind of going to normalize. I feel good about them now.
Okay.
Yeah,
I mean, much better than their starting height, right?
absolutely, absolutely.
By the way, I was thinking maybe to do like scar removal, which also we can. But then I thought about it, hey, the scars is really small and they remember me that I was short, bro. You know what I mean? So now I'm tall. I should appreciate it. When I watch my scars, like when I look at my scars, bro, I'm happy. That's the reason why I decided to live my life like that. And I mean, after 1-2 years, even you will say, "Oh, where's my scars?" Believe me. So I mean, it's because like the scar tissue is anyway really small. What we are doing. Thank you so much, and I'm so happy to see a person in front of me who's smiling and who feel much better in his body because it changed definitely the life. I mean, not the life only. It's not like because like people who doesn't know the topic or people who cannot understand why people is doing that. So guys, it's not only to say I was 5'3" before and now I'm close to 5'11", like 160 and now I'm close to 180. It's not like that. So here, I mean, a lot of things change. Small things like even a small situation in the kitchen, to take pictures, to wear some, like pants or like I don't know, like sweet and something like that, trench coats, or to driving car, like to drive a bike, like bicycle, everything, gym, muscle. I mean, even it changed the haircut, bro. I mean, like even the haircut looks different, like shorter for short men and tall men. I mean, it's amazing, but everything will change. Just like vacation, to walk in an airplane, you know what I mean, like something like that. So, and now, so you reach your goal, you are official tall, bro. So taller than me for sure, but official tall
Yeah.
also. And I'm so happy to see that the happiness in your face, bro.
Yeah.
So you did the best and just enjoy your new legs forever.
Yeah.
All right, thank you for your trust.
Yep. Thank you to Livelifetaller for being with me on this journey. Yeah, awesome.
Always, bro. Thank you so much. And greetings from Istanbul to wonderful Canada, bro. So, and guys, see you in the next video. And by the way, bro, please send us your walking. Just
Yep.
keep us in update, like to show people, okay, like, hey, this guy reached his goal, and now the walking is like in this time period. All right, guys, thank you for watching the video. See you in the next video. Bye bye.